Hi, my name is Mike Smith, and I have an osteosarcoma in my arm that's requiring me to undergo cancer treatment. The treatment that I'm undergoing is chemotherapy. Chemotherapy involves drugs being injected intravenously into a port in my chest that targets quickly dividing cells. It is done to contain the growth of and reduce the size of tumors, which hopefully will eventually allow me to have surgery to have them removed. In a typical treatment session, I go to the hospital for a few hours. During the treatment session, drugs are injected into the port that is in my artery, um, and they take my vitals before and after the test to ensure that the treatment goes as planned and there was no adverse side effects that may be causing problems. Some of the vital tests that they do are weight, blood pressure, and body temperature. How often that the chemotherapy is administered depends on the type of cancer, but in my case, I go every few weeks to undergo the injection of the drugs. Um, the drugs that you typically use in my case are fluorouracil and cyclophosphamide. These drugs interfere with the process of cell division by inhibiting proteins that are used in mitosis, and this causes the quickly dividing cells that are found in cancer to undergo apoptosis, which is the destruction of cells. Hi, it's Mike Smith. I'm back again to talk more about my chemotherapy treatment that I've been undergoing. Um, So some of you have been asking what it feels like to have undergo a typical treatment session. And so some of the side effects that I often experience after these sessions are nausea, diarrhea, vomiting, hair loss, fatigue, and fevers. I know some people experience mouth sores. Unfortunately, I haven't had to experience those yet, along with constipation and easy bruising, but those have not yet affected me, so hopefully it stays that way. Um, these side effects are difficult for me because it makes it harder for me to spend time with people because of the fatigue, and it makes my schooling difficult because I can't be in the classroom during these treatments, and I often don't have the energy to complete the assignment because of the fatigue I experience. Um, some of the longer term side effects that I will experience due to this that the doctors discussed with me are cataracts, heart problems, increased risk of other cancers, infertility, liver problems, lung disease, nerve damage, osteoporosis, and reduced lung capacity. Now, these sound like pretty severe side effects, but at the beginning of all this, me and my parents were faced with the decision that I could either ha- run the risk of compromising my future in many, many years, or I could run the risk of compromising my health right now, which would put me at a higher risk of dying due to the osteosarcoma I have in my arm. So the reason that some of these side effects occur are because the chemotherapy targets any cell that divides rapidly, which can include healthy bone marrow cells and hair cells, which results in some of the side effects, such as the fatigue, hair loss, and loss of appetite. This is unfortunate, but it's unfortunately something that I have to deal with if I want the cancer to be gone shortly. Um, some of the medical interventions that they've given me to help ease the pain that I undergo with this are dietary changes, medications such as antiemetics, laxatives, acetaminophen, and exercise, along with rest. And this has been helping me to kind of manage some of the side effects that I've been experiencing.
Hi, I'm Charlie. I'm 14 years old and I was diagnosed with rhabdomyosarcoma. So, my doctor has been talking about treating it with radiation therapy. So, they talked about it since it's localized in soft tissue near my eye, which is very close to the skin, that radiation therapy would be more effective. They said that radiation therapy uses high energy electromagnetic radiation to kill cancer cells, and this is helpful for killing cancer that is in early stages of its growth. They said it would be most useful because the tumor is in a place near my eye which would be very difficult to treat with surgery or chemotherapy. So when I get my radiation therapy, it's usually done every 5 days a week, and where they lie me on a table, and then the machine delivers radiation to my head at a very specific angle, at a very specific spot, so that it reaches the tumor every time. The table has On the table I lie very still, so that way the radiation goes to the same spot every single time. The radiation itself is painless and you don't feel or see anything, However, it does cause some side effects. A radiation oncologist is there who delivers the treatment, and he also measures how much radiation has to be given, and also things like the angle of the beam and the wavelength and necessary strength of the radiation. These measurements are taken usually using an MRI. The radiation session is only done for about 15 or 30 minutes. However, there's a lot of time in which the machine has to be aligned and other preparation for the radiation. Hi, I'm Charlie. I'm back again. After radiation, it does cause some side effects because the radiation does actually hit healthy cells and can affect them. The side effects, they mostly affect on what part of the body that is actually being hit with the radiation. But for me, since it's on my head, I mostly get a dry mouth, thicker saliva, difficulty swallowing, gives me a sore throat, sometimes changes the way food tastes, and also mouth sores and tooth decay. So most of the side effects, these are very localized towards the head, but that's the only place where I'm getting radiation therapy. Of course, if the radiation therapy were going to other places of the body, it would definitely affect those places too. However, as far as long-term effects, obviously radiation does affect the DNA of cells, so there's a small chance of developing cancer from the radiation alone. But and then there's some other short-term side effects that can become long-term, like tooth decay. And then also, like chemotherapy, radiation therapy does also, because it hurts other cells that are healthy, it does disrupt normal body processes. So obviously I have to drink more water and worry about helping my body repair and recover. So helping the side effects is difficult to do, but since that it is relatively localized, there are some things I can do, like obviously hydrating, and it helps my body recover and repair the damage, and it also helps with my difficulty swallowing.
Hi, I'm an oncologist. It means I specialize in chemotherapy and radiation treatment. As patients undergoing a difficult time in their lives, Mike and Charlie have circumstances that cause their problem to be even more difficult to cope with. As Mike and Charlie are both within the typical ages of school children, they struggle with missing out on normal aspects of life. Some of this includes falling behind in school due to their symptoms and the time in the hospital. Also, they have social struggles because they don't spend time with children their age in normal social settings. Also, they experience isolation from everyday issues. These problems can cause anxiety for Mike and Charlie for when they are done with their treatment. And in some cases, it can cause depression due to the fact that they're sad that they miss out on these experiences.